The following segment is sponsored by Aspirin Cardiology. Being heart healthy is so important, and we are fortunate to have Dr. Ben Aspirin of Aspirin Cardiology in studio to answer some of those common questions that you may have about heart health. So first off, thank you for joining us once again, Dr. Aspirin. So what are the different types of cholesterol?
Well, we tend to speak of two types of cholesterol. It's very complicated, but there's the good cholesterol, which is the HDL cholesterol, and that tends to prevent plaque and blockages from forming in the blood vessels. And then there's the bad cholesterol, which is we call the LDL cholesterol. And that cholesterol in itself isn't bad, but if it gets oxidized in the body, then it can actually cause little tears into the blood vessel walls, which can in turn lead to inflammation. And basically you can develop a little pus pocket in the blood vessel walls, which can lead to heart attacks and strokes and other bad things if the conditions are right.
And my father's father had a heart attack as well as his father. So my dad has grown up taking aspirin once a day. So what are the benefits of a low dose of aspirin, and who should be taking that?
That's a great question. It's gotten very controversial just in the last few weeks. A few studies were published, and basically these studies show that aspirin is still very effective in individuals who have already had a stroke or heart attack or some other vascular event. We know that from lots of other studies. The newer studies are questioning whether people that we use it for primary prevention, who've never had a heart attack or stroke, whether we should use it or not. And they're basically saying in most individuals we should not be using baby aspirin unless they have a lot of risk. So this is a big change for most physicians to change what we've been doing for years and years. So now that's a good discussion to have with your doctor and hopefully decide what's best for you. But probably those individuals who smoke and have diabetes and a lot of other risk factors should be on a baby aspirin. But for the vast majority of us, just using it for preventing a heart attack or stroke, it's probably not necessary.
All right, well, thank you for getting us up to date with that. Now, what are the current guidelines for our blood pressure?
These have also changed. It seems like every year or two they change, and they're being adjusted downward more and more. And probably the best advice regarding blood pressure is we want to get your blood pressure as low as the individual can tolerate it. Now, right now, the guidelines say we should try to get almost everybody to a blood pressure below 120 for the top number. That's what we call the systolic blood pressure. And the bottom number we want below 80, or that's the diastolic blood pressure. And it doesn't always have to be with medication. Sometimes it's just not smoking, eating better, watching your salt, exercising, relieving stress, that sort of thing. And then the next thing is to see your doctor, work with him or her, and decide whether or not you need blood pressure medication. Now, one thing I'd like to emphasize is make sure that you're taking your blood pressure the right way. Use a good cuff, make sure it's done in a calm setting, make sure the cuff isn't too small or too big, and do it multiple times before you go down the path of necessarily being on medication.
Well, thank you for answering questions that I didn't even know that I had. If you would like to make an appointment with Dr. Aspirin, there's more information on your screen. Thanks again.